Alright, hi everyone. I hope you guys are having a great day. So we are actually down to the last two lecture videos of the semester. So today we're going to be talking about the theories of Bandura, and then next week we'll have kind of a review as we talk about the implications for therapy and assessment when we talk about all the different things we've talked about this semester. So a few reminders for you guys today. First of all, there will be an activity this week. So we'll have an activity. It's going to be due by Friday at 5 p.m. Also, remember that you do get 2 drop grades for activities. So what this means is that if you've gotten full credit on activities 1 through 10, then you are not required to do activities 11 and 12. But if you missed an activity or if you did not get full credit for an activity, then these last couple activities can be a chance for you to earn those points back. So let me know if you have any questions about that. Also, remember that exam 4 coming up is going to be our proctored exam. This means that it will be just like exams 1 through 3 in format, so it'll be multiple choice, matching, true, false. But the difference will be that this will be a proctored exam, so it will be password protected. This means that you will need to make an appointment to take it with a proctor. Remember, this is a requirement for the online class. So the way to do this is to go into the personality course in Canvas, and then you'll look for a link to Smarter Proctoring. You'll go in there and set up an appointment to take it. Now remember that exam 4 is available from May 1st to May 5th, so it's going to be released at 8 a.m. on May 1st, which is a Monday. It'll close at 5 p.m. on Friday, May 5th. So you'll need to take it with a proctor at some point during that time. Let me know as soon as possible if you have any concerns or issues about taking this proctored exam. Okay? And then after exam 4 closes, I'll post your grade in the class and you'll be able to decide whether or not you want to take the final exam. So remember that you do get a drop grade for exams. So some of you will be happy with the grade you have after exam 4 and you'll choose to use the final exam as your drop grade. Some of you though might want to take the final exam to see if it could potentially help you. So we'll talk more about that during the introduction to next week's video, but let me know if you have any questions. So watch this video, do the activity for this week if you need more activity points, and definitely be thinking about signing up to take the proctored exam. I did also create an extra credit option for you guys that you can go in and get 4 points of extra credit for telling me when and where you're taking your proctored exam. So you don't have to do that, but why not do that to get a few points of extra credit? Okay, so let me know if you need anything. Otherwise, we're going to jump into lecture for today. Alright, so as I said, today we're going to be talking about the theories of Bandura. Now, there are going to be some aspects of today's lecture that sound similar to what we talked about last week. So last week we talked about Skinner and about his ideas on reinforcement and punishment. Basically, Bandura is going to incorporate some of that into his theory. He is going to suggest that the reinforcement and punishment that we receive from our environment is part of who we are and what we do. But Bandura is also going to suggest that we have some limited ability to control our own lives, where Skinner said that basically everything that happens to us and everything we are and do is determined by reinforcement and punishment from our environment. Bandura is going to suggest that we are able to, at least to a certain point, control our environment and therefore control our own lives. Okay, so kind of briefly looking at what we're going to talk about today with Bandura's social cognitive theory, which, just like it sounds, suggests that the way that we think about our relationships with other people, especially the people that we look up to and the people that you'll see that we're going to model, that changes what we do and who we are. So, first of all, Bandura is going to suggest that chance encounters and fortuitous events are important. Basically the idea that sometimes things happen in our lives that were not planned, not intended, but they still impact who we are. So that's going to be a part of our environment that we have little control over, but that does impact who we are. Bandura is going to say that the central human characteristic is plasticity, or the ability to control our own lives to a certain point, the ability to be flexible and to change who we are if what we're doing is not working out well for us. He's going to have an emphasis on vicarious learning, which, as you'll see, basically just means that you learn from watching other people. So he's going to say that what you do is important. Also, the way that your environment impacts you, reinforces you, punishes you, gives you encouragement, that kind of thing, as well as your own personal factors also play a role, like the way that you respond emotionally or the way that you think about something is going to play a role in who you are as well. So as I said, Bandura is going to suggest that we do have at least some capacity to regulate our lives and our environment. And therefore, if we can control our environment, that will give us more control over who we are and what we do. Now, we're going to regulate our environment and our behaviors through internal and external factors. We're going to get to that shortly. And what we're also going to see is that each individual is going to have their own moral agency, your own sense of morality, but we're going to behave in kind of odd ways sometimes when we find ourselves in morally ambiguous situations. So we'll get to that shortly. To give you a brief biography of Bandura, he was born in Alberta, Canada in 1925. He has a PhD in clinical psychology, which is going to focus on the treatment and diagnosis of psychological issues. We're going to see that he does have some things to say about where some psychological disorders come from. A lot of his research had to do with aggression. So Bandura's theory basically looking at how we model the behavior of other people. So he was the one that had the famous study on the Bobo doll. I don't know if you guys have heard of that research study, but basically if we took one of those blow-up dolls, a Bobo doll was like shaped like a clown, and if you knocked it down, it came back up. So what they would do is they would show videos, or they'd actually have a live model in the room showing the children how to play aggressively with that toy. And then there were some children who did not see that aggressive model, and then they were interested to see would people or children be aggressive with the toy if they had seen the aggressive model, and would they be aggressive if they had not seen that aggressive model for them. So he did a lot of research on aggression, and really he's well known for his idea of modeling. So let's jump right on into what Bandura had to say. So Bandura says that most of what we do is related to observational learning, which has to do primarily with modeling. Now, when I say the word modeling, what might come to your mind is basically imitating another person, doing what another person does. And that's essentially what it means, but it's a little bit more complicated than that. Sometimes we don't model exactly what we see. Sometimes we watch other people and maybe we add something to what they're doing, or we take something away from what they're doing. So essentially we're observing their behavior, tweaking it a little bit, and then trying it out ourselves. Now, the question is, who are we going to model first of all? So think about this. We tend to look to the most relevant role models in our lives and model their behaviors, which is part of an idea in parenting that children are going to model the behaviors of their parents. You look to people that you respect, or people who are of a high status, and you model their behavior. So maybe a child models their mother or father, maybe then a student models a professor, or maybe when you're in a work setting you model what your boss is doing. We typically choose models that we think of as high status, respected people, which means that we're not likely to model an individual who we see as being low status or someone who is not successful. So we don't usually model, for example, children, right? If you're an adult, you don't usually model children very much, or individuals that you don't think of as being successful or high status. So you're going to choose a model that you respect. And individuals who question their own skills are going to model others more. So if you feel like you're not as competent in a certain area, you're much more likely to look to someone else to model them. On the other hand, if it's an area that you feel very confident in, you might not feel like you need a model, and you might not look to other people as much. So it does depend in part on your own skill and your own status, right? And then finally, you're going to model behaviors that you have seen that work out well for a model. In other words, if you see someone do a behavior and they get rewarded for that behavior, then you might do it yourself. That's kind of what Skinner was getting at last week, but it's adding in this vicarious factor. You're not the one who is actually reinforced for the behavior. But if you see another individual being reinforced for that behavior, you might be more likely to do it. And if you see another individual getting punished for a behavior, you might be less likely to do it. This is the idea that if we're in a classroom setting and one student is misbehaving and the teacher punishes that student, essentially to send a message to the entire class that you don't want to get that punishment yourself, so you had better not model that behavior, right? So we're going to model people that we respect. We're going to model more if we're not sure about our own skills, and we'll model the behaviors most that we think are most reinforcing for other people. Now, we know that we don't model everything we see. We're constantly being surrounded by potential models, people that we watch on television, people that we interact with on a daily basis. Who is it that we model, and what determines whether or not we model? Well, first of all, you have to be paying attention. If you're not paying attention to the other individual, you're not going to model that behavior, and that just makes sense. You have to pay attention to it and focus on it. Notice what the model is doing. Now, if you pay attention to that model, you also have to represent it. In other words, basically this just means getting it into your memory. You have to store it in your brain. You're paying attention to it and you're storing it away for future reference. If you pay attention, if you remember it, and then later on if you're motivated to perform that behavior, right? You have to be motivated. So maybe the motivation here is that it was a person you respected that did it, and so that makes you want to do it. Or maybe the motivation is that you saw this person do that behavior and be very strongly reinforced for it. Whatever the case may be, you have to pay attention, you have to remember it, you have to be motivated to do it, and then you go out and do it. Now then, notice that if I see an individual doing a behavior and they get punished for it, I'm not going to do it. If I see an individual that I disrespect or don't respect doing a behavior, I'm not going to do it. If I don't pay attention, I'm not going to do it. If I don't remember it, I'm not going to do it. If I'm not motivated, I'm not going to do it. This explains why we don't model everything that we see. We only model some of the things that we see. Okay? And once again, if you have any questions about any of this, please let me know. So observational learning has to do with watching other people and doing what they do, with all the caveats that we just talked about. Now, in active learning, it's very similar, but it's also taking in an aspect of cognition here. It's suggesting that we do watch what other people do, and then our cognitive evaluation of the situation determines whether we do the behavior, whether we find it rewarding, whether we think that this would be a behavior that would be successful for us, right? So this is where we really take into account your own cognition. Someone else might have been reinforced for a behavior, but maybe it's not a reinforcer that you like. If it's not a reinforcer you like, something that you don't find reinforcing, you're not going to do it, right? For example, some people really love attention. And if you see someone do a behavior and they get attention for it, that's going to make you go out and do that behavior too because you want the attention. But what if you see someone else do a behavior and they get attention for it and they find that reinforcing, but you're a person who you don't enjoy attention? Then you're not going to do that behavior, even if you saw someone else get rewarded for it, because it's not a reward that you really care about. So your own personal thoughts and feelings about the situation also play a role in whether you model. So it's not necessarily just the straightforward idea that we do what we see. There's a lot of other things going on here as well. So when we're talking about our behavior here, it says human action is a result of an interaction among three variables, okay? So basically, we do a behavior, and then we either get reinforced for or punished for that behavior. That is essentially Skinner in a nutshell there. And Bandura is going to say that yes, the reinforcement and the punishment that you get for your behavior is important, determining whether you do that behavior again in the future. But that's not the only thing that's important. Your environment also plays a role here. So are you encouraged to do the behavior by people in your environment? Are the people that you respect doing the behavior? That kind of thing. And also the environment includes chance encounters and fortuitous events that we're going to get to in a second. Basically the idea that sometimes things happen in our environment and they surprise us and they're unexpected, but that doesn't mean that they don't impact us. And then finally, your own personal variables play a role in whether you choose to do a behavior or not. As we just said, maybe there's some things about the situation that someone else finds reinforcing that you don't find reinforcing. So your own personal thoughts and feelings play a role as well. So basically, what you decide to do, according to Bandura, in part is because of reinforcement and punishment that you received. In part, it's because of the influence of your environment. And in part, it's part of your own personal factors that play a role in what you decide to do as well. Now, the question is then, which one of these is most influential? If you ask Skinner that question, Skinner is going to say reinforcement and punishment from your own personal history. We know that. But if you ask Bandura the question, is it your environment, is it your past behavior, or is it your personal factors that play a role? Bandura is going to say it depends, basically. There may be some moments when the environment is very strong, when you're having a lot of peer pressure, for example, or when someone is really strongly encouraging you. There may be times when the environment is most reinforcing for you. On the other hand, maybe there's been a time in the past when you've gotten a huge reward or a huge punishment for this behavior. So in that situation, that might be the one that's impacting you most. Or maybe it's something that you think or feel very strongly about. So your own personal perspective here might be most important. So which one of these is most important depends on the situation, but all of them are important, at least in some ways. Now, as I said, part of the environment is this chance encounters and fortuitous events. It says unintended meetings of persons unfamiliar to each other or the environmental experience that is unexpected or unintended. Basically, we're talking about chance here. We're just talking about luck. You run into a person, you meet this person, you start talking to this person, and before you know it, you're married to this person. Sometimes these chance things that happen that we think are not that big of a deal, actually, if you look back, you can trace how they impacted you in a very large way. So we have some control over our lives, right? We have some control over our personal variables. We have some control over reinforcement and punishment, but we don't have any control over these chance encounters, right? So we don't have complete control over who we are. But Bandura would say we have more control than Skinner would think. Okay, which this concept of having our own control is really what we're talking about here when we get to this idea of human agency. And Bandura suggested this is basically the essence of being human, right? It's having this human agency, which is just the idea that you can choose your own behaviors, at least to a certain degree. You can plan ahead. You can regulate, control your behavior, and choose your behaviors. According to Bandura, this is a very important part of being human. So there are different core features of this. First of all, intentionality basically is the idea that you can purposefully perform actions that you think are going to bring about desired outcomes. You can intentionally choose to do a certain behavior, right? Now, that sounds obvious, perhaps, but think about some of the other theorists that we've talked about this semester. Skinner would say you really can't control what you do because it's really more about whether you've been reinforced or punished in your environment. Some of our other theorists this semester might suggest that you can't really control what you do because everything is set by a certain age and you have all these unconscious conflicts going on. So Bandura suggests that yes, you can purposefully choose to perform actions, at least in many situations. Also, according to Bandura, our human agency includes foresight or forethought, basically the idea that you can set goals for yourself and think ahead of time. This means that if you have a goal for yourself in the future, you could set little goals along the way and then reinforce yourself for meeting those goals and plan something. Now, it is true that your plan might be impacted by outside events, things that you didn't see coming, but you can still come up with a plan and then react. So self-reactiveness plays on that. Maybe you have a plan and it's not working out well for you. You can monitor your progress and change it if you need to. Or maybe you have a plan, it's working out well, and then you have one of those chance encounters where that changes everything. The self-reactiveness is the idea that you can monitor your progress, and if something's not working well for you, you can intentionally change it, right? And then finally, self-reflectiveness has to do with really evaluating your own goals and your own motives, thinking about why you're doing what you're doing. Once again, not something that all of the theorists we've talked about this semester would suggest would even be possible. Okay, so Bandura is basically suggesting that we are greatly impacted by what we see, but that we still have some control over whether we model what we see or not. And so, yes, there is definitely a role of reinforcement and punishment, but it's more to it than that, right? So self-efficacy is an important part of what we decide to do and whether we decide to model someone. Self-efficacy basically is the belief that I can or cannot do a certain behavior, right? So maybe you have a respected role model that does a behavior and they are greatly reinforced for it. And you think, okay, I really want to do that behavior. Self-efficacy is going to play a huge role in whether you do or do not try to do that behavior, right? So let's say, for example, maybe your role model just did something and you say to yourself, I could never accomplish that. Maybe I don't have that talent. I'm not musical. I'm not artistic. Whatever the case may be, you say, I respect that person. They just got a huge reward for that, but I have no faith in myself to be able to do that, right? On the other hand, what happens if you see an individual, maybe somebody that you respect, they do a behavior, they get rewarded for it, and you say, I can do that too. I feel confident in my ability. In that situation, your self-efficacy is high. So self-efficacy basically has to do with your own beliefs over whether or not you can do the behavior. Now, where do these beliefs come from as far as our own evaluation of whether we can do a behavior? Well, first of all, experiences that we've had in the past. Maybe we've tried to do behaviors like that in the past and it has not worked out for us and we've failed. Or maybe we've done it in the past and we've done a great job. You can see that your past failures and successes do play a role in whether you feel confident about your ability to do something now, right? Also, social modeling here, once again, is there someone that you look up to, someone that you respect, and maybe someone who you see as having equal ability, right? If you see another individual that you think has about the same level of ability that you have and they can do it, then you can do it, right? So then maybe we feel more confident if our classmate was able to step up and do something. We think, well, we're the same age, we've had similar experiences, we've had the same training, I should be able to do that too. So social modeling plays a role, as does social persuasion, which is basically, just like it sounds, being encouraged from other people, saying you can do this, I believe in you, or possibly discouraged. Someone might say, I don't think you can do this, you don't need to try that. And then finally, physical and emotional states has to do with your own health and that kind of thing, but especially like anxiety, for example. If you feel anxious about something, you're not likely to try it. Even if you would have been successful otherwise, anxiety often kind of paralyzes people, makes it difficult for them to move or to try something new. Okay? Does self-efficacy predict behavior? Yes. Remember that self-efficacy is basically just your own perception of your ability to do something. It's basically your confidence. So what we're seeing is that individuals who have high self-efficacy and they have an encouraging environment, they're most likely to have good outcomes. So if you feel like you're capable of being successful in college and you feel like you have individuals who are rewarding you and reinforcing you and encouraging you, you're much more likely to be able to do that, right? Now, self-efficacy has to do with your confidence that you can do something yourself. A very similar idea here is proxy agency. This is the idea that there are some things that we can't do on our own, especially in our society. We're set up in a society where we can't function without other people. So let's think about this, for example. I have self-efficacy that I can play my role in my social environment, right? I can lecture and teach psychology classes. I can be a mother and I can be a wife. But there are some things I can't do. I don't have any self-confidence in my ability to put out a fire. What happens if there's a big fire? I'm going to call the fire department, right? I don't have any confidence in my own ability to grow food. So when I need food, I'm going to go to Kroger, right? So this is the idea that we need other people to provide some things in our environment. And that's a good thing because it causes us to all work together, which is then very similar to the concept of collective efficacy. If self-efficacy means that I'm confident that I can do this, collective efficacy is that I'm confident that we can do this. So maybe you think, myself and my family, we can do this together. Myself and my friend group, we can do this together. Or even, this could be if you're trying to be a part of a social movement, or if you're trying to maybe get together and volunteer. Maybe you say, I can't feed these people on my own. I can't build this house for someone else on my own, but I can if I have other people working with me. So collective efficacy means that our combined effort is going to be successful once we work together. So there are some things that we can't do on our own. Sometimes we let other people do it, and sometimes we do it together as a group. Okay? So self-efficacy has to do with my confidence to be successful with a certain behavior. Self-regulation has to do basically with my ability to regulate my own behavior and manipulate my environment and my own consequences, right? To a certain extent, self-regulation means I can choose my own behavior and control my own behavior. So, there are several different things that play a role in my ability to control my own behavior. First of all, it's talking about external factors here. So, once again, your ability to regulate your own behavior is impacted by other people. Like, for example, society gives us social norms. There are some things that we do not because we want to, but because we have to, because society tells us to. We could spend a lot of time here. But basically the idea that you have to drive on the right-hand side of the road because that's what society tells us to do. You have to stop at a red light. You have to drive theoretically close to the speed limit, although I know that doesn't always happen that way. But the idea is that there are some social norms that society sets that play a role in our behavior. And then also keep in mind here that the external factors include reinforcement and punishment from our society, right? So it's not just that they set up standards, they also enforce those standards. Like you'll get a speeding ticket if you're caught driving over the speed limit, that kind of thing. So your ability to control your own behavior depends in part on whether your behavior is lining up with social norms and lining up with reinforcement and punishment from other people. Also, your ability to control your own behavior also is impacted by your internal factors, right? Which it have some things it says here: self-observation, judgmental process, self-reaction. Basically, this is the idea of, are you paying attention to what you're doing? And are you reinforcing yourself for doing things that you think you should be doing and punishing yourself for doing things that you shouldn't be doing? I mean, it's a judgmental process here. You do this, right? When you do something, you say something that you shouldn't have said, and you're like, well, I have to remember never to say something like that again. Or if you don't study for a test, you take a test and you fail it, you're harsh on yourself sometimes. Now, we need to be careful not to be too harsh on ourselves, and that's going to come up again in just a second. But it is important for us to judge whether something worked out well for us and whether we should do that again. So our ability to control our own behavior is in part controlled by other people and is in part controlled by our own internal factors, paying attention to what we're doing, making a determination about whether we should do that again, and reinforcing and punishing ourselves. Okay? Now, we said in the very beginning of the introduction slide that moral agency is going to be important in this lecture. So basically, each individual has your own unique morality. And where that comes from could be a whole entire other lecture, but basically the idea is that we internalize morality from society, from our parents, from religious leaders perhaps, or from the law, from social norms. And then also, as we grow, we usually add to this and change this. There may be some things that your parents thought were okay that you no longer think are okay. Or some things that your parents thought were wrong that you feel like is okay. We have our own moral agency, our own sense of morality that impacts our behavior. But then some interesting things start to happen if we find ourselves in an ambiguous situation, which basically means a situation that is confusing to us. There are some things that are cut and dry, right and wrong, and there are some things that are kind of borderline in between, is this right, is this wrong, that kind of thing. So, what do we do when we find ourselves in those situations? Well, basically, if you find yourself in a situation where what you're doing is not lining up with who you think you are, that causes something we call cognitive dissonance. It makes a person feel very uncomfortable. Now, there are several different things that we do to try to make ourselves feel better in these situations. First of all, we can redefine the behavior, which basically just means justifying the behavior. It's okay for me to do this in this particular instance because of insert X, Y, and Z justification. So sometimes we say it's okay to do this because of the situation. Sometimes we say, well, okay, maybe I know this behavior is not like the best thing I could be doing, but I'm not actually hurting anybody. We disregard or distort the consequences, basically saying, nobody's going to be hurt by this. We minimize the consequences. Or we dehumanize or blame the victims. Unfortunately, you might have heard of this. Sometimes in our society we hear this when someone has been through some kind of abuse. We make the unfortunate and unfair and inaccurate claim that it was something about them that caused that behavior to happen. Now, let me be very clear here when I say that that's not the case, that there's nothing that anyone does that brings abuse on themselves. I'm afraid that the thinking that we have about that then allows us to make the person who should be blamed for it feel better about themselves and continue the cycle. So I'm very concerned about that. But the reason why we blame the victim is because it makes us feel better about ourselves. If this person was abused because of some characteristic about them, that means that I can prevent it from happening to me. I'm not like that. I would never do that. My friends would never do that, so we're going to be safe. We know that this is not accurate, but it helps us sleep at night. The problem is then that causes us to not have any empathy towards other people, so we have to pay attention to that. And then finally, basically displacing or diffusing responsibility, saying, my behavior is not what caused that consequence. That negative consequence to another person was caused by something else, not me. It's somebody else's fault. It always seems like it's somebody else's fault. Very good. Okay. So carrying on with this idea of social learning, and remember that Bandura was a PhD in clinical psychology. Clinical psychology focuses a lot on behavioral problems and on psychopathology, so let's talk briefly about how certain mental illnesses could potentially play a role in modeling. So let's think about this, for example. When we talk about depression, we're talking about an individual who, first of all, they have to either have a loss of pleasure, so they don't enjoy things anymore like they used to, and or B, depressed mood. And then there's several other criteria that could be met there, but they have to have one or both of those plus some others. And the other criteria can include things like changes in sleep, so sleeping too much or not sleeping at all, changes in appetite, eating too much, not eating at all, loss of interest in sex, hopeless thoughts, helpless thoughts, that kind of thing. Bandura suggests that our own internal reactions, our own internal self-regulation may be the cause or one of the causes of depression. Remember that we talked about with self-regulation, there's internal factors. Basically, we're rewarding and punishing ourselves. The idea is that an individual who is depressed, according to Bandura, it could be that they're paying too much attention to the bad things in their life and not enough attention to the positive things, especially the bad things about themselves. Maybe also they're very harsh on themselves, so every time they mess up, they think it's their fault, versus every time they do something good, they think that it was just a random thing or a lucky thing, that kind of thing. So then they're more likely to be harsh and punitive to themselves. Now, we're going to talk more about this probably next week when we have our theories related to therapy, and we'll talk more about other ideas of depression here. But potentially, depression is caused in some cases by a very negative way of thinking about ourselves. Phobias are also things that could be learned through modeling or through our own internal factors and external factors. So when we're talking about a phobia, everyone has things that they're afraid of, and fear is not a bad thing. Fear oftentimes, in small doses, can cause us to avoid dangerous behaviors. The problem with a phobia is that it is now causing some kind of impairment. The person can't function in their life because of their fear. So Bandura suggested that we might learn this through direct contact with the feared object. Maybe we got bitten by a dog, and that then has caused our phobia. Or maybe we have inappropriate generalization. So maybe we say, okay, well, this one angry, huge, mean dog bit me. So that must mean that all dogs are then dangerous. So we take that and apply it to situations in which it's not true. Or it could also be observational experiences. If you see another individual being attacked by a dog, I'm just using a dog as an example here, it could be anything. But if you see another individual being attacked by a dog, then you might then internalize that. Remember, we talked about how the reinforcement and the punishment that you see someone else receive play a role in whether you do a behavior or not. So you can also learn this from watching other people. And then finally, aggression. I talked about how he did the study with the Bobo doll. So children who see aggressive models are much more likely than to be aggressive, right? So maybe we observe other people who are aggressive, and this is one of the reasons why there's a lot of research and concern about corporal punishment, physical punishment with children, because children often then go and imitate that with other individuals, or they learn the idea that it's okay for you to physically harm another person if you're the bigger and stronger individual. So this is something that we're concerned about. But basically, sometimes individuals observe other people being aggressive, or maybe they are reinforced for being aggressive in some way. Or maybe they receive training or instruction. This is like the children who watched the violent model beating up the Bobo doll, then they were more likely to do so as well. Now, depression, phobias, aggression, these are just a few examples here. There are several other issues that could be related to modeling in some way, and that's what I want you to think about for your activity this week. Now, remember that you get 2 drop grades for activities, so if you've gotten full credit on 10, then you don't have to do the other 2. But for those of you who have missed one or not received full credit for one, Activity 11, discuss ways in which psychological issues could be learned through observation. So we already talked a little bit about depression, about phobias, about aggression, but there's more to say there. Other anxiety disorders, post-traumatic stress, for example, generalized anxiety, OCD, substance use. How could substance use be the result of observation? And then how could we undo this learning? So if an individual learned from another person to use substances or to be inappropriately aggressive, how are we going to change that behavior? Okay, so this is what I want you to think about for your activity this week. Let me know if you have any questions. Remember, it needs to be at least 200 words long. So finishing up our last little bit of lecture here for today, Bandura's his theory of therapy is basically that individuals have learned behaviors that are not functional. Maybe they've been reinforced from their environment for dysfunctional behaviors. Maybe because they don't feel like they have the self-efficacy for good behaviors. I know that I can do the bad behaviors. I'm not sure I can do the good behaviors. So the goal then is to help an individual feel like they have control. So self-regulation means you have control over your own behavior. Help the individual to realize they have control over that. Help them identify some behaviors they might like to change, first of all, and try to instigate that, get a start on that, set a goal, right? Remember earlier we talked about how goal setting is a part of human agency, about how we have control, we can set goals, we can monitor our progress towards that goal. If at all possible, it would be helpful if we had an individual who was modeling this new behavior we're learning. And if we can get that, that's great. If we can't, then we have to teach the individual to be their own model, to change the way that they're thinking. When we say covert, it's something that's not obvious, not outward, but inward, where you're paying attention to yourself, you're modeling for yourself good behavior. And then maintaining this new behavior might mean that you need to find individuals in your life who will reinforce you for this, who will encourage you for this. You need to reinforce yourself for this, and then continue going to therapy as long as is necessary. So, critique of Bandura. Bandura's theory is pretty good. It's very high on generating research, internal consistency, parsimony. It's a fairly simple, straightforward idea. It's high on falsifiability. It would be very easy to prove or disprove this idea of modeling. All we would have to do is, like for example, set up the Bobo doll study and other studies to see if individuals model. Well, remember that we're going to model people we respect, people that we hold in high regard, but we could falsify that. It makes sense. We organize knowledge. It's very practical. It can guide action. So a therapist can use this information to help a person identify behaviors that might be there because of modeling and change them. So we would say that Bandura is higher on free choice because human agency says that we can regulate our behavior to a certain extent. It's optimistic, lots of focus on the conscious over unconscious. Social factors over biology, so it's not necessarily that you're born with these problem behaviors or born with good behaviors. It's that you have been modeling and been reinforced for certain behaviors, and so then we have to try to undo that if we need to. And then uniqueness over similarity. All individuals model the people who are relevant to them. All right. So please let me know if you have any questions about any of that material. Remember that you do have Activity 11 this week. Please be sure that you're setting up an appointment to take Exam 4 as the proctored exam. Just let me know if you need anything. Otherwise, have a great day.